My story with the Health Foundation actually begins in the summer of 1998. I was approached by Mike Rawl from the Chester County Community Foundation. The Chester County Community Foundation, right after the foundation was founded, the Phoenixville Community Health Foundation, the Community Foundation Chester County was entered into a partnership or a consulting contract with the new foundation to help get them off the ground during the formative year. And so I was approached by Mike Rawl. I was at the time the CEO of the Stuart Houston Charitable Trust in Coatesville, and he said, you know, we had a discussion the other day, and the criteria that they were looking for and kind of fit you to the T. Would you be interested in interviewing for the position? So I said, yeah, I would. So after going through an interviewing process, I was offered a contract in early August of '98 and started September 1st of '98. And it was one of the greatest moves I ever made in my professional career. I spent 21 years here after 6 years at the Stuart Houston Charitable Trust. And just fell in love with the community, with the foundation, its purpose, its mission, the board, which was terrific. So it was a great beginning, I think, for me and for the foundation. So that first year, we actually were located at the Valley Forge Professional Center, about 1.5 miles down the road from where we are now. And that was intended to be a temporary location, and it was temporary for 9 years because we must have looked at 25 different places over that 9 years and we finally came up with this wonderful facility at 821 Gay Street that just fit the bill really well. And our for-profit subsidiary called Chestmont Valley Ventures was the entity that actually bought the facility, and we rented it from our for-profit entity, Chestmont Valley Ventures, for about 3 years. And Chestmont renovated the place, made it beautiful, made some improvements, and at the end of the third year, they donated the building to the foundation. So we moved in here in August of 2007, and for the last 15 years, it's been a wonderful home for the foundation and probably will be for many, many years to come. Well, the foundation started off with $32 million, and that was from the sale of the Phoenixville Hospital to the University of Pennsylvania Health System. And during the negotiations, as I'm told, because I wasn't on staff at the time, but I'm told by the original board members that in the negotiations with Penn, they agreed to sell it for $32 million, but if Penn were to sell the hospital within the first 10 years of the merger, that the newly created foundation would get an additional $16 million. And so Penn ran into financial problems, and in the seventh year of the merger, the hospital was sold to a for-profit health entity called Community Health Systems. Penn Health System is a nonprofit health system. So our board got the $16 million to put into the foundation, but they also negotiated back the $4 million that had been given to the hospital during the period when the hospital was under the aegis of the Penn Health System, which was nonprofit. So in August of 2004, we got $20 million. Dick Kunsch not only told me, but told other people that there were two basic reasons why the board agreed to merge with the Penn Health System. One was in case the merger didn't work out, that they would have the money in this new foundation, okay, to buy back the hospital, okay? So that's one reason. The other was if the merger did work out, which it did, then there would be plenty of money to help the community in improving health and human services care for the greater Phoenixville area. So there were like two purposes, and at least during the whole time I was here, we really took the purposes to heart, and the last thing that Dick Kunch said to me when I signed my contract in his office in August of '98 was, and I'll never forget this, he says, I want the foundation, he was the chairperson, the original chairperson for 6 years, I believe it was. He said, I want the foundation to reach into every sector of the community and to be as broadly influential and impactful as possible. So we as a staff and the board really took that to heart, and I think we did a pretty good job of that in terms of practicing what I call community philanthropy. And community philanthropy is basically, I always describe it as total immersion into the community by both the board and the staff, not just in giving out grants, but using the time, the talents, and the contacts and influences of everybody connected with the foundation to help improve the community. And back when the foundation started in 1998, the operational part of the foundation started in '98, Phoenixville was a vastly different community than what it is now. It had been suffering for about 20 years, the ravages of the iron and steel industry leaving. There were a lot of vacant buildings downtown. There was a lack of activity. And our foundation, again, with the words of Dick Kunch in our ears, we played a role in helping with the revitalization of Phoenixville, because we encompassed the concept of healthcare. To us also encompassed economic health of the community. So we participated in various ways in the original revitalization of Phoenixville. But probably the best thing that we ever did was creating, with the help of a consultant, the healthcare access program, which provides dental, vision, prescription assistance, and emergency orthopedic services for people who can't afford it, who have they're underinsured or uninsured. And to this day, thousands of people have been helped with that program, and it was a unique model that the consultant suggested to us, and it's worked like a charm. That was and always has been the largest grantee of our foundation, like over about $500,000 a year, and it's money well spent. Well, I kind of look at it. I kind of look at the achievements and impact of the foundation in a couple of different ways. One is obviously through grant making. And from the day we started until right now, the foundation has been fortunate to be able to give back to the community about $46 million in grant activity to health and human service organizations. And in some cases, we also gave grants to the Borough of Phoenixville, to the police department, and the fire companies and water rescue units because of how important they are to the community as well. Aside from the grant activity, as part of the community philanthropy idea, we started a number of different programs that were, I think, essential and important adjuncts to the grant-making activity. We started a Ride for Health program that opened up access to healthcare and human services for people who had a difficult time getting to the services that are out there. Now, we're very fortunate in Phoenixville to have a lot of really good nonprofit organizations. It's probably in the neighborhood of 35 or 40 different organizations. But the Ride for Health program basically is now, I think it's still going on. It costs us about $65,000 a year only. And we had a number of nonprofits who joined the program. And in a nutshell, if their clients needed a ride, they got that ride through a cab or through SEPTA. and the clients don't have to pay anything for it. That was huge because getting access through transportation is really important. A lot of low-income people just don't have means of transportation. So the Ride for Health program was a really important one. Another one is, I mentioned the healthcare access program, but another one is the youth and philanthropy program, that we felt that it was important to school the next generation coming up in the importance of philanthropy and giving back to your community. So in about 6 different schools, we initiated this program that was managed by Lynn Hartman on our staff, the VP for programs, to teach kids about philanthropy, and it was hugely successful. The Ride for Health program, the Youth and Philanthropy program, the Community Health Leadership Academy was where we basically had a semester-long program for average people in the community who wanted to get involved and give back to their community. And the Community Health Executive Leadership program was another program, but that was for executive directors and people who were aspiring to be executive directors. And it was pretty much almost as intense as a graduate seminar for a whole semester. And so those programs were very important to us in starting the foundation. Some of them still exist today, and they were all evaluated by Villanova University and got high grades for their effectiveness and impact. So I guess the bottom line of this is trying to be a full-service type foundation was not only through grant making, but through the development of programs that we felt that we were fully serving the community. And in addition to that, we actually started a number of different collaborations. One is called the Hub program, which we introduced to the school district and is still going on today, that provides basically a round table, if you will, of many different agencies in addition to the school district to help the families in the school district who were having difficulties, and to try and arrange in a very practical way solutions to what problems the families were had going on in their lives that are affecting the performance of students at the school. Another one was we played a role in the ACEs issue. The ACEs issue is basically an issue dealing with people that have gone through lots of different trauma in their life, and particularly kids. So for several years, we actually met here at the foundation and helped to provide a more of a highlighting public awareness through different ways of what the issue was about. And for 12 years, we actually had the Greater Phoenixville Mental Health Advisory Council, which we had a round table again of people representing different agencies, including the police, on how to better address mental health issues in the Greater Phoenixville area. And when I mentioned the Greater Phoenixville area, by the way, we've always defined that as the school district boundaries, and that is the borough of Phoenixville, East Pikeland Township, and Schuylkill Township. So that's always been our little piece of the world, so to speak, to try and impact and to make a difference in that area. I've never really thought that we had a tremendous amount of challenges, but my view when I started was to do whatever I needed to do to make everybody aware that we were here. I remember visiting all the townships and going to township meetings to let them know, hey, we're here, and if we can help you in some way related to health or human services or public safety, we'll entertain your request. So we did that, and then we started also local cable television too, as an adjunct to the overall mission of the foundation. We had a health show called For the Health of It. Obviously, and I interviewed a lot of people from connected with the hospital, but other healthcare related professionals as well, to highlight information for people about different diseases and things like that. And then there was another show called Poking Around Phoenixville, because we wanted to highlight all the good things going on in the community, and that was also very successful. And we had that for 20 years, and it was very enjoyable to do, very popular in the community, and people who didn't get recognition, the average person, got some recognition. And it was one of the, as the host of the show, one of the things that I found so fascinating, that in a small town like Phoenixville, that there were so many interesting people and things that had gone on in the history of the community, how many professional athletes came out of here, so many authors, poets have come out of Phoenixville. The poem called The Charge of the Light Brigade, the last surviving person in the poem of the Light Brigade is buried in Black Rock Cemetery on the north side of Phoenixville. Not many people knew about that. People didn't know that that Phoenixville had a professional football team from 1907 to 1921, and that was really a good team, and they were a forerunner, one time removed, of the Philadelphia Eagles. The team in Phoenixville was called the Big Red, or the Union, Big Red Union. That morphed into the Frankford Yellow Jackets, and then the Frankford Yellow Jackets in the late 40s morphed into the Philadelphia Eagles. So we have a connection as a community to the Philadelphia Eagles through that. Most people didn't know that, but through our collaboration with the Historical Society and doing several TV shows with them, we found that out. In terms of what I would suggest for people coming behind me, in my role as CEO and also the boards, the future boards, is one, to maintain a broad view of what philanthropy is in terms of practicing community philanthropy. And as I explained before, it's community philanthropy is kind of a total immersion into the community and having as broad a view as possible about how the foundation, with its influence of money, time, expertise, and so forth, can really help play a role in turning around a community and making a difference.